For those with an active lifestyle, nothing can slow you down more than pain, especially joint pain. Though pain can occur anywhere in the body, and it can be caused by any number of conditions, there is no need to live in pain or discontinue an active lifestyle.
Pain from arthritis, particularly as it afflicts the younger individuals, can take on many forms. Obviously, there's pain with activity. It can be associated with a catching or popping or locking phenomenon with any of our weight-bearing joints. But the pain can also just be a chronic nagging ache, and it can also afflict us at night. Typically, when pain bothers us at night from arthritic-related conditions, that's when the game is over and things need to be addressed.
Whether the answer to your pain is as simple as physical therapy or as complex as total joint replacement, there is a solution for every type of orthopedic ailment. In order to make an informed decision, it is important to know your options.
Simple options always start with medications such as aspirin, non-steroidal anti-inflammatories, or Tylenol. We use local anesthetic and steroid injections or viscosupplementation with hyaluronic acid. When those don't work, we will try bracing and external supports.
Dr. Mark Scioli is an orthopedic surgeon in Lubbock, Texas, specializing in joint replacement, spine, and lower extremity reconstruction. He says more and more people under the age of 65 suffer from arthritic knees and are seeking options to relieve pain and maintain an active lifestyle.
We always first examine the patient and take a history. Based on those findings, we will take x-rays, radiographs, sometimes a CAT scan, sometimes an MRI, and we will even in some instances have the benefit of arthroscopy, where we actually look inside a joint, assess or treat pathology, and based on all of the factors that we assess, we then define a treatment plan.
Joint replacement for younger individuals is becoming more common. At his practice, the Center for Orthopedic Surgery, affiliated with North Star Surgical Center, Dr. Scioli uses custom-made implants based on each patient's own anatomy, which optimizes implant fit and performance.
Custom implants are made from either a CAT scan or an MRI that takes into account the three dimensions of a joint and its surfaces. The benefits to a patient are that this is their joint line that is being accommodated for with the implant. The implant is made for that patient, not the patient made for that implant. And it has benefits with preservation of bone, cartilage, and the ligament structure when it's implanted.
My knee is stiff. At night when I would go to bed, my knee would ache and it would be swollen. I would notice that when I got up in the morning to get ready to go to work, get out of bed, I could hardly put any weight on my left leg because of my knee. I've tried anti-inflammatories and went from there to exercises to injections in my knee. None of that has relieved me. Maybe temporarily for a day or two, the injections would help, but then it'd come right back. So I'm trying to reach a solution to where I'm able to be more active.
The minimally invasive partial knee replacement procedure has generated significant interest because it entails a smaller incision and faster recovery than traditional total joint replacement surgery, and can be safely performed at a short-stay surgical facility like North Star Surgical Center. Only the most damaged areas of cartilage are removed and replaced.
Partial knee replacements replace only the part that is damaged. Therefore, we spare the cartilage, ligament, and bone in the rest of the joint that is not altered, and therefore the patient, in theory, should have a quicker recuperation and a return to function sooner than regular knee replacement surgery, for instance. Typically 4 to 6 weeks, though, is required for recuperation.
Couldn't kneel down. It was hard to get up even from a sitting position. I walked with pain in my knees 24/7, all the time. And since I've had the surgery, every day just gets better. I'm able to do a little bit more every day. I walk faster, can even run a little bit, whereas before I was in so much pain that I couldn't run. I couldn't walk up and down stairs. You know, I would have to take like one stair at a time, and you know, now I can do it normally. So it's really helped a lot.
Currently, Controversy exists over whether or not younger patients should have joint replacement surgery because of the potential for the implants to fail or prematurely wear out.
The implant wear and failure with a partial knee replacement is much less, in theory, than it would be with a full knee replacement, where we resect a greater amount of bone, ligament, and cartilage, leaving much less tissue to work with for later revisions. So the newer implants preserve those structures, and when we have to go back in later, we have things to work with that make the revision much more successful.
I'm 6 weeks out of my surgery. I had a partial knee replacement. It is amazing what you can do when you have this type of surgery. I was riding a bike 3 weeks post-op. I am very pleased with it. It has really changed my ability to get around.
The Center for Orthopedic Surgery and North Star Surgical Center have been providing Lubbock with the best service and cutting-edge technologies for over 20 years. The practice is a driving force for excellence in surgical and non-surgical orthopedic procedures and has become a premier orthopedic practice in the region. The Center for Orthopedic Surgery and North Star Surgical Center provide Lubbock and the surrounding areas with optimal care and rehabilitation. The staff is always striving to provide the best service and best solution for its patients. To learn more about Dr. Mark Scioli at the Center for Orthopedic Surgery and North Star Surgical Center, or to make an appointment, call today or visit greatbones.com.